All right, hello and welcome again to a webinar where we're going to talk about goal setting and mindset. The idea about this is to be more confident and specific with your intentions, and the idea is that you can then achieve more. So there's a number of reasons why people don't achieve the things that they're setting out to do with exercise. But one of the easy wins you can have is to structure your goals in such a way that all your efforts can be directed at the priorities first. So before we go into how to do that, I want you to have a think about in your life. It doesn't have to be exercise. It could be just other goals that you've made over your life. And when I say goal, it doesn't have to be like anything too fancy or major. It could just be, maybe at one stage when you finished school, you were going for your first job or something like that, and your goal was, I need to develop the certain skills and prerequisites to get to that job. And so in that regard, just to use a really easy example that everyone would agree with, I'll use myself as an example, is that in Australia, to practice as a physio, you have to pass the degree and then get registered. And so when I was finishing school, I wanted to be a physio. I was like, okay, well, then I'll make my goal to finish physio in the next 4 years and then go into work. And then to do that, I have to list down all the things that I need to do to get that done. Now, that's pretty obvious, all right? But the idea is that you can do that level of thing with exercise based. It's just not as obvious if you're not working in the area. So if you haven't worked in body work or physiology or exercise type stuff, then it's just about learning a few different principles that you've started to learn over the last few years, if you've been tracking with us, about what types of exercises to do in certain situations to make it more likely that you'd meet your goal. And so that's usually the missing thing, is that people are working very hard. This is what I've noticed. People work really hard. People work like they work when they're really motivated. There's no faults there, right? In a lot of people. But often they're doing the wrong kind of thing that will help them to get to where they need to be. And that is a problem, because you're putting all this effort in, but you're not reaping the rewards. And rather than just trying harder, we're just saying, if we focus in on these things, one at a time, and prioritize them in the right way, you can work smarter and not harder, and you can achieve your goals, and get further. So that's really what I wanted to go into more specifics. So I'll just recap some things from a previous webinar. So the previous webinar, we talked about specificity in rehab, and specificity in exercise physiology land just means that if you want to get better at something, you have to specifically do that thing to get better at it. Like, that's all it means. And it was so important that they actually deem it a law of specificities, and you would understand that in terms of you reap what you sow, right? It's like a universal thing that if you want to get good at something, you've got to practice that something. Now, it is obvious, and I know that you all know that well. What isn't obvious is, if I have a certain physical goal, say to improve my movement in my shoulder joints so I can reach without pain, how then do I specifically do the exercises and things that will do that, but not give me pain and other things? All right. And that's not obvious, right? Especially if you haven't done any work. Or the big one that we find is, if I have a balance impairment where I'm struggling with my balance and I'm more likely to have falls, or maybe I've had falls, how then do I improve my balance? What specific things do I need to do so that goal gets realized? Okay. So that's the first thing. So I'm just going to go over these again, just to recap. And again, if this is already well known, great, you've done really well. But you usually have to think about this a lot until you really just get it drummed in, because it isn't common sense. So let's just go over the main things. So for balance, for instance, if you want to get better at balance, you've got to do, guess what, balance, right? And so if you want to get better at balance and you're just walking, you won't achieve optimum levels of balance. You just won't, because walking is, you obviously have a little bit of balance to walk and walk over a different terrain. That will create a little bit of balance in challenge, but you won't get to the point where you're optimizing, because walking is not the thing to get you there. Walking is wonderful. I recommend that everyone walks, and we should all do that. But if your goal is set at, I really want to improve my balance, literally zone in on balance. Okay. If your goal was to say, I want to be able to walk further so I can get to the shops, get to the cafe, or do my shopping and feel like I'm getting there, well, guess what? You do more walking, right? If it is, I want to do more gardening and lift the rocks in the garden, or push the wheelbarrow and do all that sort of stuff, it's a strength-based goal mostly. And so guess what you have to do? You have to lift and push and pull heavy things. So you have to do strength training. So it really I really want you to kind of get that real simple, high level thinking. Whereas like, if I want to get good at this, I do that. If I want to get good at this, I do that. If I want to get more flexible, I have to do flexibility work. If I want to get more endurance, I have to do endurance work. If I want to do more strength, I have to do strength work. If I want to do, you know what I mean? And it's just like anything else in life. If I wanted to get better at doing a crossword, well, guess what? You have to do crosswords. And it's just the universal principle that just won't be broken. So that's really, really important for you guys if you're coming with goals around balance, strength, mobility, coordination, pain, reaching, all the rest of it. Yeah, that's the first thing. So when we've done our little journals that you've all got, if you don't have a journal, just let me know and we'll send one to you. But each term in Standing Strong, we're going to use the journals to identify what are you working on that term. And we've given you the top 5 reasons that people will give me in class. And I want you to try and focus in on one main one. Now, you may be working on a few things, and that's totally okay, but I want you to have at least one main priority where you're spending, say, 80% of your efforts really zoning in, because you're more likely to make good progress there and get that sort of rolling to a point where you can start doing other things and then you're maintaining that. And that's key. So what we've asked you to do is demonstrate if it's a balance goal, a mobility goal, and that's about getting more movement in your joints, like getting less stiff. Whether it's a strength goal, whether you feel like you can push, pull, lift, carry, anything a bit heavier. And that can be looking at things like, well, when I'm going shopping, the shopping's really heavy to carry, or the trolley's hard to push, or if you've got grandkids that are really young and I can't lift them up, or things like this, or I'm struggling to get out of the car if it's low. All of those are strength-based goals. The other one is pain. So have I got a goal to reduce musculoskeletal pain? So for instance, you might be strong, but your knee might be sore, which won't allow you to do your general mobility or strength. Okay, so it's not a strength problem, it's actually a pain problem, because that way you do your exercise therapy and your modalities to decrease pain first, and then when that comes on board, you can actually you opened up to do more stuff with more things. And the other main category was around weight management. So as you can understand, it's very hard to maintain a good weight in Western countries. You probably noticed that any Western country that's developed, we've got access to all this stuff. We've got overload of advertising that it pushes the fast food. We live busy lives. It's just harder to lose weight. And a lot of you have identified, I really want to try and drop a few kilos to take some stress off my joints. And that's a great goal, because that really is an evidence-based goal to try and lose that. So again, that might be where you're at, is that you're going well with everything else, but you might just want to lose a little bit of body mass just to help feel more comfortable, help move, decrease your risk of chronic disease, all the rest of it. Okay, and if that's the case, then you need to do the specific guidelines that have been shown to work nicely for that. Now, so that's the big picture. That's the first thing I want you to dial in on and look at. So the first big error people make is they go, well, I want to work on all of those. So they circle all of them, or they're going for everything. But you quickly realize you'll almost achieve nothing, because you're trying to spread yourself too thin, and you can't dedicate enough resources in your day to get any of them over the line where it's actually starting to become a lifestyle. And it doesn't feel like that's the right way to go about it. But in all the people that I've worked with and other health professionals I've worked with, it really is the way. Just pick one or two main things that you just really focusing on. Okay, so just to go back, step one is you get what you train for, you reap what you sow, specifics. All right. The second thing is you want to identify which of those main fitness areas, whether it's joint mobility, whether it's strength, whether it's balance, whether it's pain relief, or whether it's weight maintenance. There's other things as well, but they tend to be the top 5 things that our group's identified. And you just go, yep, this next term or maybe this year or however long, I want to get to the point where I'm actually making considerable progress in that. So that's the next thing. And avoiding the error of going too hard too soon. Now, to go back to goals, right? We want to teach you a little format that some of you might have used, but some of it might be a bit novel to you. And it's called developing a SMART goal. And it's one way of many that you can do goals. It's not the only one. Now, some people would be a little bit averse to doing this because they're like, oh, I don't want to do goal-based stuff. It's too routine and rigorous. So don't let me force this upon you. No, we don't want it to be you must do this or else. But for the kind of people that where you're like, if you can specifically identify and drill down a bit into that goal, then I see people, and the research shows too, that they make more progress and they're more likely to achieve their goals because it's actually a bit more detailed in terms of what that looks like as an outcome. So let's go through a couple of examples, right? I'll tell you what the SMART stands for first. So this is in your little diaries and that sort of stuff, and we will give you some more info on it. So feel free to write this down, but this will be recorded too, so you can watch it again. SMART goals means that every goal you set should have a component that is specific. So that's the S, so specific. And that goes through that principle we're talking about, that when you make a goal, it's got to be dialed in enough so you actually know what you're aiming at. So it's like the target, right? If you don't have a target, how can you possibly direct all your resources towards that target? Because you might fire the arrow in the wrong direction, right? So you need to have it dialed in, and the more dialed in you have, you're more likely going to hit the bullseye, if that makes sense. So that's S for specific, okay? M is for measurable. So measurable just means you have to be able to know how you are going in your progression towards that goal. You need to be able to put a figure on it to say, I've progressed this far. So to use that archery analogy again, it might be, I want to hit the bullseye. Okay, so that's the specific thing is we're trying to improve our archery to hit the bullseye, right? Now, the measurement would be, if you don't hit the bullseye, you know you haven't got your goal. So you can measure it. You can measure it by how close you get the arrow to the bullseye, right? Or how many shots you are within that vicinity. So you can actually measure it, right? And the thing is, you can do this with strength, balance, that sort of stuff. You can actually go, this is the point I'm trying to get to, and this is how I know I'm getting closer to it. So that's the S and the M. And that's really critical. The A is for attainable or achievable. And that just means it's got to be in that realm where you are likely to be able to train yourself to do this. Now, a lot of people, myself included, you set goals that are quite idyllic, and I do this all the time, and they're probably not achievable in the time frame that you've set for yourself. So, for instance, it could be someone who hasn't run before, and they go, I would like to do a marathon in 12 weeks. Now, there are plenty of ways you can get towards doing a marathon, and I'm not suggesting this is your goals, by the way, but there's plenty of ways that you can get to use a marathon, but you're probably going to need at least, if you've never done one before, never run, you're going to have to start by just doing half a K, like a couple 100 meters. And it might take a year or two to really build up to that. So the goal, as far as the end target, is fine, but it's not attainable within the time frame that's going to be reasonable for you. Now, some people, if you had, say, arthritis that was really really painful, or if you had joints that were fused, or you had different medical conditions where your heart rate wasn't stable and that sort of stuff, it might not be attainable because the goal is just unsafe for you to do. Okay, so attainable is just being quite true to what is possible to achieve. Now, sometimes you might need help with that because if you haven't seen anyone achieve like a balance goal or a strength goal, you might have a limitation in understanding or at a mindset level, because basically society has told you that you can't do things if you're a certain age, right? And that's actually a myth. It's a lie. And that's one of the main things we're trying to come against in Standing Strong, is to say that you are very capable of doing so much more than society or even yourself would have you believe. And so that attainable thing can be unlocked by a bit of education sometimes, where you, for instance, would say, no, this is the kind of thing that's possible with people at your age, with your injury history, your gender, for example. So that's A for attainable. R is sort of, it's got a very similar feel. It's like a brother or a sister to attainable, and it's relevant. So relevant is trying to make it in line with your values, or in line with what is meaningful for you at this time in your life. And I often feel that comes down to things like interests. Okay, so it's got to be relevant to you in terms of interests. So for instance, for me, I'm not really interested in cycling, for instance. I think it's a wonderful sport, wonderful fitness, but it's just not my thing that I would enjoy most. I would much prefer to run or maybe swim, all right? And that's just knowing yourself and knowing, yeah, I don't really, you know. And so if I was to set a goal, for instance, around cycling, it's not going to be relevant to me. And people would go, oh, well, why would you even find anyone doing irrelevant goals? It's not that people start doing things that they don't like to do, right? But I do see people setting irrelevant goals in the sense of, this I see every day probably, is they go, I've got knee pain and I've been told that I need to do cycling or this to manage my knee pain. But it might be good for you, but it might not be relevant because you hate the thing, right? And so in terms of relevant goals, I would say in that scenario, you would go, well, is there a way in line with my lifestyle that can achieve the same thing, but I don't have to go through drudgery to do it? And when you speak to, like if we're working one-on-one together, we will look at, these are the list of things that you can do to do that. And generally we find things that are more aligned with how you like to operate. And that just makes it more successful, right? The other thing I see all the time is that people go, I have joint problems or asthma and I have to do swimming. Now, again, swimming is wonderful for those things. It really is, right? And we recommend it very, but if you're like, I hate the water, right? You don't want to push that, because it's very unlikely for yourself to get to that goal, because you're not going to overcome that in a hurry. It's much better to say, this is the kind of thing that I like to do, and we'll work that way. So that's that relevant. Okay, so it's subtle, but it's quite important. And the T is for time-based. T is for time-based. That's probably the easiest one to understand, is that when you set a goal, put a time frame around it. Because if you make the time frame unlimited, there's no pressure to get there. And I don't mean you should be full pressured, by the way, but there's no kind of motivation to kind of like, well, if I structure my time right, I'll be able to get to this goal in say 12 weeks. But if you have this unending limit, then you will less likely to be able to organize your time and resources to achieve it in that time frame. It'll go on and on and on, and then it'll be demotivating, because unless you're making progress, it's pretty hard to keep on an exercise program. So what we've done in terms of Standing Strong is we recommend that you do some goals term by term. So like quarterly goals, quarterly of the year goals. And that way it's not so long term that it's going to take ages and you don't see any progress because you're measuring it too infrequently. But you're also able to measure it every term and just see, wow, I did actually make some, and it's motivating. It gives you a little bit of room to move. And I find that to be the nice, for a lot of goals, a nice time frame. Just to go through that again, S for specific, you get what you trained for. M for measurable, you need to be able to have a way of showing how you're improving or progressing towards that goal objectively. A is for attainable, as in like don't make it outside of your ability within that time frame. R is for relevant, as in like make it work for your lifestyle and enjoyment and interest and the rest of it and resources. And T is for time frame, which is, you know, how long are you going to take to achieve this goal? So the more complex the goal, the longer it's going to take. The simpler the goal, the less it's going to take. All right, so that's SMART. So that's the main principles of doing that. So we're encouraging people this term, and we actually need this from you guys to at least submit a goal to us, because that's how we make sure we ensure we get the funding through for our streams, because we have to do practice goal-based rehab as a service provider. But in reality, it is the better way to get towards your goals. Okay, so let's just spend the next little bit looking at how then could you construct a goal in that format that will help shape your actions. So I'm going to use balance as the first example because probably, I don't know, I feel like 70 to 80% of people in Standing Strong have a definite balance goal, probably higher than that, but I reckon about 70% are like, that's the one thing that they want to change because I've noticed it's suffered. So here's the first thing wrong people do. They go, I just want to work on my balance, right? So can you see how if we're looking at aligning your behaviors, aligning your systems and routines, right, to get to that goal, if you just say, I want to work on my balance, it doesn't give you anything to latch onto, to hook your routine onto, because what does that mean? You know, what does that look like? And so inevitably people go, I want to look at my balance, and then and all they do is stand on one leg, right? And they get pretty bored by that after a couple of days because it's not relevant enough. And then it drops off and they never achieve their goal. So in that example, I'll try and give you kind of like a little bit of a case study of this avatar of top people that we would get. So, you know, maybe it's Mrs. Smith, and she's noticed in the last year she's had maybe 2 or 3 falls, and that's the first time that's ever happened. So, you know, she's at high risk of falls, and she's noticed that she's feeling quite fearful of having another fall, as you can imagine, and the rest of it. And she also noticed that it was only really happening when she was outside, like in the garden or walking up and down slopes and uneven terrain. She also realized that she used to be a keen bushwalker, and now she's avoiding bushwalks that have obviously uneven terrain, and she's starting to get limited in that environment to be able to do anything. So if we apply that SMART-based goal framework to that, one way could be like this. I want to work on improving my outdoor walking balance to enable me to confidently walk on easy to moderate hiking trails with without fear of falling, with or without a walking aid in the next 6 months. All right. So can you see how when you put all that extra detail on it, suddenly you're saying, I want to improve my confidence, which means that all you have to do is measure your confidence. And that can be as simple as saying, what's my confidence out of 10? 10 out of 10 being I'm certain and confident. 0 out of 10 is like I'm really fearful. You can just periodically test, where am I at there? And you'll notice that improve as you do more, right? And that'll be motivating. It'll also be such that because you've identified the goal as being outdoors and that's where you feel worried, well, then it's also going to help you to construct your training where you're going to have to need to do outdoor stuff to be specific at that goal. It's relevant in terms of you love bushwalking and that sort of stuff. And so it's in line with a definite desire that you've got. So it's going to be motivating to get to that goal. It's realistic because you've actually been able to do that. It's attainable because you've actually been able to do that recently. And the only reason why you're not doing that at the moment is because of the appropriate fear, because you've had a few falls. And time-based, you've given it a good 6 months to really retain some level of confidence. So you've got all those things, and suddenly you know that in your program, you have to do lots of balance work, you have to do outdoor walk, you have to work on your confidence, you have to put into that routine. And so you're doing all those different types of exercises where from that, you can go, I need to do stepping exercises because it involves steps. I need to do walking on different surfaces because it involves that. I need to be able to do quick steps and recoveries in case I was to trip. I've got to do all that into my practice so that it does that. And then you just incorporate the balance guidelines, which is, I know that the more balance I do, the better I'm going to get. And if I really work hard and work up to a couple of hours a week, I'm going to get a really nice result. So everything is bonus. So you can do that with any goal. And if you get stuck, just reach out and we can help you with that. But can you see how if you structure it that way versus I'm just going to improve my balance, it's much more likely that you're going to hit that target. And that's the idea. Okay. So just to recap, we encourage you to zone in on that very compartment of fitness that you're after. So that could be strength, balance, mobility, pain, or weight loss. There are obviously many other things like coordination, and power, and reaction time, and flexibility, muscle endurance, cardiovascular endurance. There's like heaps of things, right? So you identify the thing that's most important to you at that time or feeling like that's limiting you. And then you pretty much arrange your training to specifically target that. Okay. And you go and you use all your resources to target that. And I can all but guarantee that that'll be a better way of doing it. And people then when you get to that goal, you go, well, I achieved that. And then you can work on the next thing and you get a bit of momentum. Because we get that dopamine release in our brain when we hit a goal and it starts to help make it easier to get into flow with things. So utilize that process. And then you want to use the SMART framework, so specific, measurable, attainable, relevant, and time-based. And you just sort of check in periodically to see how you're doing with that. Sometimes people write that down and they realize, wait, that wasn't really what I was after. But when they write it down, they go, oh yeah, I was actually really after this, And that way, when you put pen to paper, you can actually see more comprehensively about what you want. Because sometimes we don't know what we want. We think we do, but when you actually journey it, you're like, oh, it wasn't really that. Okay, so you will see that changes over time, and that's okay. And the other thing is just to make sure you do it in groups or with friends and with a coach. And so in our regard, you got myself and Simon as your coaches. You might have your own health professionals as coaches, or you might have your own support club. But when you actually share that process with another and journey and check in, it brings that context and meaning so that goal doesn't sort of fall to the wayside, so to speak. And we have data that suggests that when people share a goal with a close friend or with a with a health professional or whatnot, they're more likely to achieve it because they've verbalized it. They're kind of manifesting that reality, so to speak. They're giving themselves accountability by someone to say, oh, hey, how you going with that? And you're like, oh, yeah, not so great. And they go, come on, let's go, And so you get all that too. So that's just a little introduction to goals. So in terms of the things that we do need from everyone this term is just to either on that little journal is just to write down in that space that SMART goal, all right, and identify it. And then that way we can help you more. So if we get a number of people identifying the same goal, we can actually structure your training around that a bit better. We can put programs around that in terms of the the Physi app and the like. We can do Zoom record. We can do lots of stuff on that. So it helps us, helps you. Hopefully everyone's happy. But that'd be the one thing that I've not seen people do a lot of, because they haven't been taught how to do that. They haven't known how to do that, or they thought it was just a tick a box exercise. And I've just found that it hasn't been. So be really intentional about what you're going after, because it's very rare in physio practice to see someone achieve something that they wanted to achieve unless they've really been intentional about it. It doesn't usually happen by accident. There are rare cases, but it's just, I don't see that very often. So if it's meaningful to you, then take a couple of minutes, take 5-10 minutes, and then look at, well, how do I construct my routine around it? So to go back to that example I gave about the balance, it might be, you might ask yourself, how many minutes or hours a week can I dedicate to this long term? And you might go, you know what, I can dedicate 15 minutes a day. All right. And the next step would be like, well, when am I going to do those 15 minutes? Am I a morning person? Am I an evening person? Or is every moment just hard? Right. And if that's the case, you just plug it in there into your routine. And then you would look at accountability partners. So you'd be like, you know what, I've got a friend where we've got a similar goal. So if you find friends with similar goals, you're more likely to pull each other along and be interested in each other. So find a friend in class or elsewhere to say, you know what, we've both got bushwalking goals and we both have that thing. Why don't we enlist each other's support? And maybe once a week you just have a cuppa, a phone call, and you just see how much you'll improve. I've just seen people improve so much that way. It's incredible. So do that. And then you can go, well, what equipment do I need to achieve that goal? So for the balance, you might need to get a little portable step. You might need to get some balance mats or stepping stones, or you might need to draw up little kind of grids on the floor somewhere so you can do stepping practice, you can do reaching practice. So you get your equipment and you set it up so it can actually be more likely to get to your goal. And then the last thing you would do would be to kind of journal it. So you would record the sessions you do and the measures that you do, and you would display it somewhere so you know you're getting closer, because that's super motivating. All right, so that's kind of like your quick 30 to 45 minute in on goals. Have a think about it, share them with me and each other. And if you get stuck where you're like, I don't actually know how to get to this goal, we'll give you the resources to say these are the kind of things that you need to do to construct an exercise program, and then we go from there. Because the more you can learn about how to treat yourself, the easier it's going to be. And everyone I've coached through this purpose who's just been intentional about that long-term stuff, they make progress. Okay. And really, you need encouragement, you need accountability, you need to be intentional, and I think and you need to believe you can do it. And that's the real key. So I hope you enjoyed this little overview of goals. It's not the only way you can do goals, but it's just an easy way to identify and drill down into things. So I'm going to just stop the recording now, and then for those here, we can actually do some just interactive discussion if you feel to. All right.